Joey Sloan? Could you hang on for a second? Joey Sloan?
I'm Mrs. Sloan. I'm Mrs. Sloan, Joey's mother.
Hang on a second. Hi, Mrs. Sloan. I'm Arnold Morton, the pharmacist who filled your son's prescription. You should give Joey a teaspoon of this medicine 3 times a day until it's gone. Keep it in the refrigerator and shake it before you give it. Now, it's best if you give it to him on an empty stomach, and he may have some diarrhea after a couple of days, but you really don't have to worry about that unless it gets real bad. And if it does, or if Joey doesn't get better, in a couple of days, then you should call your doctor. Sure, I'll be right with you. Any questions?
Not really.
Sure, I'll be right with you.
I just hope this makes him feel better.
Oh, I'm sure it will. Okay. Yeah, that was
How did things go with Joey at the doctor's today?
Well, he has an ear infection, but he's going to be fine. The doctor gave him some medicine.
Well, do we need to have the babysitter give him the medicine while we're gone?
No, we don't need to until tomorrow. He gets 3 teaspoonfuls a day, and I'm going to give him all 3 just as soon as I get home.
The critical role of the pharmacist as a source of patient education is increasingly being appreciated. Recognizing the importance of patient education, the Indian Health Service has developed a program for training pharmacy students and pharmacists in effective communication techniques. This highly successful training program has been adapted by pharmacy programs throughout the country.
And I'd say, yeah, everybody should be counseled. The only bad thing is sometimes where I work now, you fill 300 prescriptions a day. Everybody wants to know, all right, is this 25 cents more than it was yesterday or not? And that's mostly what they're concerned about. And you're sitting here trying to tell them, hey, when you use this,
I hear what you're saying, but is that your perception or is it the patient's perception that they're more concerned with cost than information? Whose perception is that?
I think it's a little of both of us. Because
have you ever asked them if they want to know about their medication more? Has anyone ever asked a patient when they come into the pharmacy whether they want to know about how or why or problems that may occur?
No, the people don't want to know in some of the big chain pharmacies. The patients want them to get them and get out.
There's a physical barrier between you. Generally, you're standing up and they're down at a lower level than you are. All of these things don't put someone in a receptive environment to hear information. In addition, you're busy. You may be uncomfortable in talking with patients, and we jokingly talk about how our pharmacists push the button and turn on a tape recorder and say, take one teaspoonful 3 times a day, 1 hour before meals and at bedtime till it's all gone for your asthma. Now, what does that sound like? Does that sound like he cares that this medicine's important? And in fact, so many times you're given just the opposite impression. So we're going to teach you a slightly different approach. It's a markedly different approach to doing it that will change that environment and help you overcome those barriers.
Use the Tylenol whenever they have a temperature. I'll give a dropper full.
All directions on the box.
Right. And then for the pseudoephedrine, give that 4 times a day. 1/4 teaspoon.
Okay, do you have any other questions?
So we can tell them all we want, but if they can't, they will take it.
And often, if you have water there, you may even, in the child, you may even want to try giving that first one.
That's your thiazide. That's a diuretic. That's used for your blood pressure. And I'd say this, you take this.
Actually, the patient consultation and the whole process and all that we've been doing has been very, very exciting. Over the years, we worked on a series of techniques to help pharmacists more effectively manage drug therapy in patients. We've discovered that in spite of all the training we've received in school, that many times we don't know how to effectively communicate with patients. And so what we've tried to do is develop a few simple techniques that will allow us in a very short period of time to effectively communicate with patients.
Who's more readily accessible than the pharmacist? I mean, you can't really walk down to your doctor's office and walk in and say, hey, I got this problem. But look how many pharmacies are out in the United States that you can just walk in and talk to a pharmacist. He's available. He's very accessible. And their role, I feel, in pharmacy is to be information sources and provide information to patients. And I feel that the dispensing functions, even though they still are important, take a lesser role because You don't go to school for all this length of time just to sit there and count and pour.
So we're trying to get the environment so that there is a two-way dialogue between the patient and the pharmacist. And it has several advantages. The first is the patient tends to retain more of the information. Secondly, the pharmacist, it's an advantage to him, particularly if he's going to do many consultations, because since he's not repeating, we call it the tape recorder. They push the button and it's take 1 teaspoonful 3 times a day. After the 10th time you've given this, it tends to give out an attitude to the patient that this is routine, it's not important, it doesn't matter, and that you don't care. By allowing the interchange to take place and only filling in the gaps, everyone becomes different, it becomes more personalized, and the pharmacist stays fresh in each consultation, even though it may be over the same drug.
One of the most important aspects of patient consultation is to make sure that the environment is conducive to effective patient learning. While it is not always possible to find a quiet, private setting for patient education, you should attempt to create as private a setting as you can, with little separation between you and the patient.
Mr. Arnold?
Yes?
Hi, I'm Betty Fox, your pharmacist. I have your prescription from Dr. Sari. I see this is your first prescription for nitroglycerin, so I want to go over with you how you'll take this medicine.
Patient counseling begins at the moment of the introduction. Identify yourself to the patient. Establish rapport with the patient. Verify the patient's identity and clearly state the purpose of the counseling. The essence of good patient counseling is to verify what information the patient does or does not know, and then to fill in the gaps you have identified in knowledge. This can be done most effectively through the use of open-ended questions. Let's see the traditional closed-ended approach.
Did your doctor tell you what the medication was for?
Yeah, he pretty much went over it.
And you know about the refills?
Yes?
This closed-ended question only gives you a very limited amount of information. On the other hand, an open-ended question lets you assess what the patient knows rather than putting words in his mouth.
What did your doctor tell you this medicine was for?
I've been having some chest pains, and he said this medication would help relieve the pain.
That's right.
In this program, we will be learning about 3 open-ended questions, the prime questions. What did the doctor tell you the medication was for? How did the doctor tell you to take the medication? And what did the doctor tell you to expect? Let's look again at the first prime question.
What did your doctor tell you this medicine was for?
I've been having some chest pains, and he said this medication would help relieve the pain.
That's right.
With the first open-ended prime question, you are able to assess the patient's perceptions of the nature of his illness and what the medication is intended to do. It has also given you an estimate of the patient's level of sophistication and knowledge. You can then decide what, if any, additional information you must provide to the patient. Let's look at the second prime question.
How did he tell you to use the medication?
Whenever I feel one of my pains, I'm supposed to take 1 pill, and it will make the pain go away.
What has the patient's answer told you? Are you convinced that he really knows how to take the medicine? If not, you need to ask another open-ended question to explore further whether he really understands how to take the medication.
Tell me more about how you're supposed to use it.
I take it when I have chest pain. I guess I just swallow it. I didn't quite understand. He used a term I hadn't heard before, something. I just assumed you swallow it like other pills.
With an open-ended question, you identified a critical gap in the patient's knowledge. As you might expect, an important role of the pharmacist is to fill in these gaps.
These pills are different than other medicines you've taken in the past. These are meant to be placed underneath your tongue and left there until the pill dissolves.
So, I don't swallow it?
Correct.
I leave it under my tongue until it all dissolves?
Right. There it will be rapidly absorbed and will quickly help relieve the pain in your chest.
Notice that the information provided by the pharmacist was limited to filling in gaps in the patient's knowledge. Those gaps were identified by open-ended questions. Let's go on to the third prime question. As you observe the interchange, think about how the open-ended question can save the pharmacist time.
What did your doctor tell you to expect when you take this medication?
He said it would work right away. Within a minute or so, I should have some relief. I thought that was pretty fast.
It is. That's exactly how it's supposed to work. What did he tell you to do if it didn't work?
He said I should sit down or lie down, and then I could wait about 5 minutes and then take another tablet. And I could repeat that up to 3 times. If it didn't work by that time, I should call him or get to an emergency room.
A major benefit of this approach to patient education is that it can save you time and effort. It allows you to easily verify those things which patients already understand so that you don't have to go over these items again. Now, let's look at the rest of this interchange. Try to identify when open-ended questions are used.
Did the doctor tell you the name of the medicine?
Yeah, he called it nitroglycerin, I think. That worried me a little bit. Won't blow up, will it?
No, it's perfectly safe, but it has some other characteristics that are different from most other medicines. What did the doctor say about storing this medication?
Nothing really.
Okay, this medicine is kind of special. You need to leave it in the bottle it comes in. The medicine will go bad if you leave the cap off or if you carry the tablet around in your pocket outside of the bottle.
So I have to leave it in the same bottle?
That's right. Leave it in the bottle until you're ready to use it.
What was the open-ended question?
What did the doctor say about storing this medication?
After going through the 3 prime questions, identifying gaps in the patient's understanding and filling in those gaps with information, there is one more step. This last step, final verification, is the single most important concept in effective patient counseling. Final verification is the process of asking the patient to tell you what he understands about how the medication should be used. Think of the final verification as asking the patient to play back everything he has learned so that you can listen, observe, and verify that the patient's understanding is complete and accurate. You want to double-check that there is no discrepancy between what you told the patient and what he actually understands.
Just to make sure that I didn't leave anything out, could you please go over one more time how you're going to use it?
Okay. Whenever I feel this chest pain, I'm going to put 1 pill under my tongue. I'll know that it's working if it's burning under my tongue or if I feel lightheaded. Is that right?
That's right. What are you going to do if the pain doesn't go away after you take the nitroglycerin?
Hopefully the pain will go away within a minute or so. But if it doesn't go away within 5 minutes, I can go ahead and put another one under my tongue and let it dissolve. And if that doesn't work, I can try it one more time before calling the doctor or going to the emergency room.
Right.
I can't put it in the same pill box with my other medicines. I have to carry it in a separate bottle that it comes in. I think that's all I remember.
Good. Do you have any other concerns or questions?
No, I feel relieved after talking to you.
This last step, final verification, is a chance to double-check how well patients really understand what was explained to them. It also serves a very important role, having the patients affirm to themselves exactly what they will be doing.
No, I think you've covered everything.
What you have just seen is a simple system for patient education.
The whole issue is verification and using the patient as a database to interact back and forth. And once you find out what they know and then verify what they know is correct and then fill in the gaps, you know, in the process, is getting away from the traditional tell them how to take it versus verifying that they understand.
If you give them all the information in the world and you don't verify that they understand, then basically you've wasted a lot of people's time. You've wasted the physician's time, you've wasted your time, and you've wasted the patient's time. So the bottom line is, the goal is not to provide information, but to verify the patient's understanding.
Let's go back to our first case, Mrs. Sloan, and see how this approach to patient education can be applied. As you watch this case, try to identify the 3 prime questions.
Joey Sloan?
I'm Mrs. Sloan, Joey's mother.
Hi, Mrs. Sloan. I'm Arnold Morton, the pharmacist who filled Joey's prescription. I'd like to go over how you're supposed to use the medication.
Okay.
What did the doctor tell you the medication was for?
He said he was going to give Joey some amoxicillin for his ear infection.
That's correct. Dr. Lendl gave Joey a prescription for amoxicillin. It's a form of penicillin, and it's often used for ear infections because it works so well. Now, how did the doctor tell you to give the medication to Joey?
Well, he was pretty busy and got interrupted by a phone call. I remember he said something about 3. I don't remember if it was 3 doses or 3 teaspoons, but I do remember the 3.
Well, the doctor wants Joey to take 1 teaspoonful 3 times a day.
So I'll give him 1 teaspoonful, but I'll give it 3 times a day.
Correct. Now, when do you think you'll give the medication?
I guess when he gets up in the morning, sometime around the middle of the day and before he goes to sleep.
That's fine. Now, you really don't need to wake him up at night to give him the medicine. If you need to give it to him around mealtime, try to give it to him about a half hour before the meal so he's taking it on an empty stomach.
Okay, let's stop for a second. Do you begin to get a sense of the process? The open-ended prime questions give you the big picture of what the patient knows. You then may follow up with some probing but still open-ended questions to more exactly define the state of the patient's knowledge. Then, when you have a good idea of what the patient knows and doesn't know, you only have to provide the information which the patient actually needs. Let's go back and join the case.
So don't give it with the meal.
Right. Now, what did the doctor tell you to expect from the medication?
Well, he just said I should come back if Joey didn't feel better.
And what did the doctor say about how soon you should bring him back if he doesn't get any better?
I think he said I should come back if he doesn't feel better in a couple of days.
That's usually what he tells his patients. Now, the medication should make him feel better within a couple days. And if it doesn't, then you should go back to your doctor or at least give him a call. What else did he say?
That's really all. I mean, the office was real busy today, and he was in a hurry.
Do you see the value of the open-ended question? If the patient responded by telling you the drug's side effects, then no further consultation would have been necessary. But since you have discovered this information missing, it will be very important to discuss it at this time.
Well, something else you should be aware of is that this medication may cause diarrhea. His stools may be loose and the frequency may increase. But don't be alarmed. I mean, that's common with this medication. But if it becomes excessive, say more than 6 stools a day, then you might want to let your doctor know.
So unless it gets really bad, don't be concerned about it.
Good. How long did the doctor tell you to use this?
I think he said I should give it to Joey until it's all gone.
Did you see what happened with that open-ended question? It told you that the patient already knew how long to take the medication. You may choose to reinforce this understanding, but you certainly don't have to introduce the concept from the beginning.
Okay, that's correct. Even though Joey should feel better in a couple days, it's very important that he takes the medication till it's all gone. You need to give it to him for the full 10 days.
10 days? Well, that's a long time.
Well, it is, but he might not get completely better unless you give it to him for the full 10 days.
Okay.
By now, you should be familiar with this technique. But before we let this patient go, there is one very critical part of the counseling process that must be performed. Can you remember what that is?
Just to make sure I didn't forget anything important, would you go over how you're going to use this medication?
I'm going to give 1 teaspoonful 3 times a day, and I'm going to give it to him in the morning when he gets up, around lunchtime, but at least a half an hour before the meal, and then before he goes to bed at night.
Good. And one thing I forgot to tell you is that you need to shake it before each use and store it in the refrigerator.
Do I just shake it once a day?
No, shake it before each use.
Oh, okay. It's sort of like salad dressing.
Exactly. And how long are you going to use it?
10 days until it's all gone.
Any other questions?
No, I think that's pretty clear. 1 teaspoonful 3 times a day.
What happened in the final verification process? Our pharmacist discovered that there was something very important that he forgot to tell the patient. That happens to all of us. The process of final verification allows you to double-check what the patient knows and identify these types of gaps in their knowledge, or to identify things that you may have forgotten to tell the patient.
I heard that we're too busy to do this. So do you feel it's not important enough, or what? What's your comment? I've heard a couple of things. Well, we just don't have the time to counsel these patients. So what do you do?
I have to produce. So I'm like, all right, here we go. And man, while you're taking this, take it without food if you can. If not, and you say it rather rapidly, and you try to make yourself as convincing. So you throw a lot of information in there, but whether I have enough time, especially I find it a problem with the geriatrics.
Why do we even bother filling it to begin with? And that's the premise of why we feel so strongly about verification. And verification, using the patient as a database, assessing their knowledge right up front by using open-ended questions, is this technique takes actually less time.
While the interactive technique seen thus far is valuable for patients who are taking medication for the first time, the majority of patients come in for refills of chronic medications. For these patients, an abbreviated technique called show and tell serves to verify that the patient is using the medication properly and monitors for unwanted side effects. Show and tell consolidates the whole counseling process into a very short period of time by combining the 3 prime questions with the final verification. The 3 prime questions are modified somewhat to reflect the fact that the patient is already on a medication. What do you take the medicine for? How do you take it? What kinds of problems are you having?
What we call is a show and tell when you do a verification. And what you do is you open the bottle and put the pill maybe in the cap, and you show the patient and you say, how do you use this? And they look at it and they go, I don't know what that's for. And you very quickly have found out that, uh-oh, what's happened?
Let's see how this works. As you watch this case, observe the patient and the nature of any potential barriers to effective communication.
Hi, I'm George Poor. I called my refills in. Are they ready yet?
Hi, George. I have them right here. I just want to go over them with you.
Oh, I really don't have the time right now.
This will just take a second. I want to make sure we're giving you the ones you need. We can do it while she's processing your credit card.
Okay.
What do you take this one for?
That's for my diabetes.
And how do you take it?
I take it in the morning, just once in the morning.
Fine. And what kinds of problems are you having with it?
None. I feel really fine as far as my diabetes is going. My sugar is well controlled.
And what do you take this one for?
That's for my blood pressure.
And how do you take it?
I take it once a day, 1 tablet a day.
And what kinds of problems are you having with it?
None. I haven't been having any problems. Am I supposed to be having problems?
Not at all. I just want to make sure we haven't overlooked anything or that things haven't changed since the last time we filled your prescription.
No problems at all.
That entire counseling session took 50 seconds.
There you go. That didn't take any time at all.
Thanks. Thanks for taking the time.
How did this patient seem when you first saw him? When he started the interchange, he was certainly hurried and a little bit agitated. That barrier to communication was reduced with the non-defensive way the pharmacist handled the situation.
The technique is, sure, maybe you're providing information, but you're verifying that patients understand that they know how to take the medication. I'm not talking about going through the list of every side effect that's listed for a particular drug. Let's make it simple. Let's start out with verifying that they understand that what 1 twice a day means. And so when they leave your pharmacy, they know that they're going to take their medication maybe in the morning and maybe in the night. And you have done your job because you know that they understand when they leave that they're going to take it correctly. That's a first premise of what we try to teach or try to get our pharmacists to do. If you have the time to expand, that's great. But the first thing you want to do is you want to verify that they understand how to use the medication. Because if they don't take the medication right, they're going to have a drug misadventure, they may not get well, and you wasted everyone's time in the system.
The thing I was trained to do, and initially when I first got into the Indian Health Service, was provide information. I'm transferring all this vast knowledge I have to those people. Well, again, most of the patients early on walked out the door, and I had no idea whether they understood me. I had patients, some of them who couldn't speak English, some who couldn't hear, some who couldn't see. And it was amazing when I began to ask patients to demonstrate how to draw up insulin. And I found that I had 1 out of 10 patients, when I asked them to draw up their insulin dose, went like this. And I'm going, whoa, no wonder we're having control problems with this patient. And I'd look at the dose that had been drawn up, and it was totally different than what the doctor prescribed. The goal is to verify before they walk out the door, to make the patient demonstrate to you, either by verbally, by giving back to you the key pieces of information, or by demonstrating how to use it, in the case if you use the inhaler and everything. Because if we don't, what have we really accomplished?
Let's watch this next example to see how to use demonstration when the show and tell technique uncovers a problem with patient compliance. In a sense, this is the ultimate type of open-ended question.
Hi, Ted. I have your asthma medication refill ready. I noticed you've been using it more lately.
Yeah, well, it's basketball season, and I only use it just before practice or a game so that I don't get an asthma attack.
How do you use your inhaler?
I take 2 puffs just before I go out onto the court.
What kind of problems are you having with it?
No problems, except that the medication doesn't seem to be working.
What do you mean it doesn't work?
Well, the doctor told me that if I used it, I wouldn't get tight when I exercise, but I still do.
Well, these inhalers are hard to use, so if you show me how to use it, maybe we can see if that's the problem.
There, then I repeat this for my second dose. I hate getting this stuff all over my lips.
Part of the problem is that you're not getting a full dose. Let me walk you through the technique. I noticed that you didn't shake the inhaler up before you used it.
I'm supposed to shake this?
Yes, I mean, if you don't shake it up, you may not be getting any medicine into your lungs. It may be just staying in the can.
So, I'm supposed to shake it up like this?
Right. Now, you took a deep breath, and that's exactly what you should do. But I noticed that you sprayed the dose first, then took the breath. Now, what you need to do is take the breath in, let it out, and then start to take a big breath in, squeezing the inhaler about halfway through the breath.
Is that why it gets all over my lips?
Well, that's probably why. But the other thing is that after you breathe in, you have to hold it in. You hold your breath in as long as you can, and then slowly let it out.
I think I can do that.
You mentioned earlier that you take a second dose right away.
That's right.
The medication will work better if you wait about a minute before you take the second dose. You inhale 1 puff, just like we talked about, then wait a minute, and then inhale a second puff.
Okay.
Now, this is pretty complex, so to make sure that I didn't leave anything out, show me how you're going to use it.
Okay. I'm going to shake it up, then take a breath in, let it out all the way, then begin my breath again before I press the inhaler.
Show me. Show me how you do it. Much better. What are you going to do about the second dose?
Wait about a minute.
Any other problems?
No. Hey, that feels like it really worked that time.
Well, you might not be able to really tell unless you get out and exercise.
What you have seen is the use of demonstration to correct a patient problem detected while using the show and tell consultation technique. It actually shows you what the patient is doing as well as what they understand. In a sense, having the patients demonstrate what they are doing is the ultimate open-ended question.
I believe that that's what we should be doing. I believe that, that the profession of pharmacy has kind of like a, their goal should be to inform, patients about their medication. And I think that we have an obligation to patients to tell them about, their medication. And if we don't do that when they come in to see us in the pharmacy, I think that if they come in and we don't take the time or feel that we're too busy to talk to patients, that we're doing a very disservice. I really feel like I have an impact. I like the feeling of talking to patients, making them understand and get them actively involved. And I feel that when they leave, after I've verified that they understand how to use their medication, is that they're going to go home and use it properly and that they won't have any problems and that I've actually made an impact on patient care.